In the midst of the ongoing opioid crisis, Narcan has emerged as a life-saving antidote. This video explores the potential side effects of Narcan, shedding light on the intricacies of safeguarding lives in opioid overdose emergencies. As the opioid epidemic continues to grip communities worldwide, the importance of immediate response cannot be overstated. Narcan, also known as Naloxone, is a medication that can reverse the effects of an opioid overdose, providing a vital window of opportunity to save lives. While Narcan is undeniably a critical tool in the fight against opioid-related deaths, it is essential to understand its potential side effects. By delving into the possible adverse reactions that might occur with the administration of Narcan, we can better educate first responders, healthcare professionals, and individuals on how to navigate this life or death scenario. From common side effects like nausea and vomiting to more severe complications, such as withdrawal symptoms and cardiovascular issues, being aware of the potential risks will help foster preparedness and swift action. Discover how Narcan can be used effectively while managing its side effects, ensuring that lives are safeguarded during opioid overdose emergencies. Understanding Narcan and its role in opioid overdose emergencies. Narcan, or naloxone, is a medication that works by binding to the same receptors in the brain that opioids attach to, effectively blocking their effects. When administered promptly during an opioid overdose, Narcan can reverse the symptoms, including slowed breathing and loss of consciousness, potentially saving a person's life. One of the key reasons Narcan has become such a crucial tool is its ease of use. It can be administered through various routes, including intranasal sprays, auto-injectors, and intramuscular injections. This accessibility empowers not only healthcare professionals but also bystanders and family members to intervene in an overdose emergency. It is important to note that Narcan is not a substitute for professional medical care. While it can reverse an overdose temporarily, individuals who receive Narcan should still seek immediate medical attention to address the underlying causes of the overdose and prevent future incidents. Common side effects of Narcan. Like any medication, Narcan does carry the risk of side effects. However, it is important to remember that the potential benefits of using Narcan in an opioid overdose emergency far outweigh the risks of not intervening. The most common side effects of Narcan include nausea, vomiting, and increased heart rate. These reactions are generally mild and short-lived, subsiding within a few minutes after administration. It is crucial to reassure the individual who has received Narcan about these side effects and ensure they understand that they are temporary and necessary for their well-being. In some cases, individuals may experience withdrawal symptoms after Narcan administration. This occurs because Narcan rapidly reverses the effects of opioids, essentially sending the body into immediate withdrawal. Withdrawal symptoms can range from mild discomfort, such as restlessness and muscle aches, to more severe manifestations like agitation and tremors. While withdrawal symptoms can be distressing, they are not life-threatening and should resolve within a short period. Rare but serious side effects of Narcan. While rare, there are some serious side effects associated with Narcan administration. These side effects require immediate medical attention to ensure the individual's safety and well-being. One potentially severe side effect is pulmonary edema, which is the accumulation of fluid in the lungs. This can lead to difficulty breathing and chest pain. If an individual experiences these symptoms after receiving Narcan, it is crucial to seek medical help immediately. Another rare but serious side effect is cardiovascular complications. Narcan can cause a sudden increase in blood pressure and heart rate, which may be problematic for individuals with pre-existing cardiovascular conditions. It is important for healthcare professionals and first responders to be aware of this possibility and monitor the individual closely after administering Narcan. Managing and mitigating side effects of Narcan. While the side effects of Narcan can be distressing, they are generally temporary and resolve on their own. However, there are steps that can be taken to manage and mitigate these side effects, ensuring the individual's comfort and well-being. To alleviate nausea and vomiting, individuals can be placed in a side-lying position to prevent choking and aspiration. Providing a calm and supportive environment can also help reduce feelings of distress. For individuals experiencing withdrawal symptoms, reassurance and understanding are essential. Educating them about the temporary nature of these symptoms and providing support can help alleviate anxiety and discomfort. In some cases, healthcare professionals may administer additional medications to manage severe withdrawal symptoms. Tips for administering Narcan safely and effectively. Administering Narcan correctly and promptly is crucial for its effectiveness in reversing an opioid overdose. Here are some tips to ensure Narcan is administered safely and effectively. Familiarize yourself with the specific administration method of Narcan you have available, whether it is an intranasal spray, auto-injector, or intramuscular injection. Read the instructions carefully and practice the technique if possible. Call emergency services immediately before administering Narcan. While Narcan can temporarily reverse an overdose, professional medical care is still necessary to address the underlying causes and provide comprehensive treatment. If using an intranasal spray, ensure the person is lying on their back with their head tilted slightly backward. Administer the recommended dose into one nostril, and if possible, switch to the other nostril for the second dose. If using an auto-injector, follow the instructions provided, making sure to firmly press the device against the outer thigh to release the medication. If using an intramuscular injection, locate the upper outer quadrant of the individual's buttock and administer the medication at a 90-degree angle. Apply pressure to the injection site for a few seconds to prevent bleeding. Remember, proper training and education are vital for individuals who may need to administer Narcan. Knowing how to identify the signs of an opioid overdose and responding appropriately can save lives. Narcan training and education programs. To ensure the widespread availability and effective use of Narcan, training and education programs are essential. These programs aim to educate individuals on recognizing the signs of an opioid overdose, administering Narcan correctly, and providing immediate care while waiting for emergency medical services. Narcan training and education programs are often conducted by organizations such as community health centers, local health departments, and harm reduction organizations. They may include hands-on demonstrations, simulations, and discussions to empower individuals with the knowledge and confidence to respond effectively in overdose emergencies. Additionally, online resources and educational materials are available to supplement in-person training and reach a wider audience. These resources provide valuable information on the safe and effective use of Narcan, as well as other strategies for preventing opioid overdose and promoting harm reduction. Resources for accessing Narcan and overdose prevention kits. Access to Narcan and overdose prevention kits is crucial for communities impacted by the opioid crisis. There are various resources available to ensure the availability of Narcan to individuals who may need it. Local pharmacies often stock Narcan and can provide it without a prescription in many areas. Some pharmacies may also offer training on Narcan administration and overdose prevention. It is worth checking with local pharmacies to determine their specific policies and offerings. In addition to pharmacies, many harm reduction organizations and community health centers distribute Narcan and overdose prevention kits. These organizations often provide Narcan free of charge or at a reduced cost to ensure that it is accessible to those who may not be able to afford it otherwise. The importance of Naloxone distribution programs. Naloxone distribution programs play a vital role in combating the opioid crisis. These programs aim to make Narcan readily available to individuals at risk of opioid overdose and their loved ones. By increasing access to Narcan, Naloxone distribution programs empower communities to take immediate action in overdose emergencies. Naloxone distribution programs can take various forms, such as community outreach initiatives, harm reduction centers, and collaborations between healthcare providers and community organizations. These programs often provide Narcan training alongside the distribution of overdose prevention kits, ensuring that individuals are equipped with the knowledge and resources needed to save lives. By promoting widespread Naloxone distribution programs, communities can take a proactive approach in addressing the opioid crisis and safeguarding the lives of their members. Supporting individuals and communities affected by opioid overdose. Opioid overdose not only impacts individuals but entire communities. It is crucial to provide support and resources to individuals and communities affected by opioid overdose, both during and after an overdose emergency. For individuals who have experienced an overdose, connecting them with appropriate healthcare and support services is essential. This may include referrals to addiction treatment programs, mental health services, and support groups. Providing a non-judgmental and compassionate environment can help individuals feel supported and encourage them to seek the necessary help. Communities can also play a role in reducing the stigma associated with opioid use and overdose. By fostering understanding and empathy, communities can create an environment that encourages individuals to seek help and reduces barriers to treatment. Conclusion: saving lives with Narcan. Narcan, with its ability to reverse the effects of an opioid overdose, has become an invaluable tool in saving lives amidst the ongoing opioid crisis. While it is crucial to be aware of the potential side effects of Narcan, the benefits it offers far outweigh the risks. By understanding and managing the side effects of Narcan, we can ensure its safe and effective use in opioid overdose emergencies. Through comprehensive training and education programs, widespread access to Narcan and overdose prevention kits, and the support of individuals and communities affected by opioid overdose, we can work towards safeguarding lives and combating the opioid crisis. Remember, Narcan has the power to provide a second chance at life. Let us continue to prioritize its accessibility, education, and responsible use to make a lasting impact on the individuals and communities affected by opioid overdose. Together, we can save lives and bring hope to those in need. Thanks for watching.